Hello everyone, I am Associate Professor Dr. Wen-Long Hu, Chief of the Department of Acupuncture at Kaohsiung Chang Memorial Hospital in Taiwan, and President of Taiwan Traditional Chinese Medicine Medical Association. It is my pleasure to share our research with you. The presentation title is The Utilization of Chinese Herbal Products for Hyperthyroidism in National Health Insurance System of Taiwan, a population-based study. Our work has been published in the journal eChem in 2022. Hyperthyroidism is a disease characterized by excessive levels of thyroid hormones in the blood. Thyroid hormones influence almost every tissue and organ system in the body. Graves' disease and toxic multinodular goiter are the two most common causes of hyperthyroidism. The prevalence is 0.75% in Europe and 1.92% in Taiwan. The prevalence of hyperthyroidism increases with age. Hyperthyroidism is more frequently in women. The clinical manifestations of hyperthyroidism include weight loss, osteoporosis, atrial fibrillation, embolic events, muscle weakness, tremor, neurals, psychiatric symptoms, and rarely cardiovascular collapse and even death. It is essential to assess the severity of thyrotoxic manifestations, especially cardiovascular and neuromuscular complications, in order to formulate an appropriate treatment plan. Why patients with thyroid diseases choose complementary and alternative medicine? Helping to cope with the side effects of medication and treatments including fatigue, dry mouth, weight gain, and mental fogginess, easing the stress and anxiety of medication and treatments, or worries about having a lifelong diagnosis, trying to help with their care or to treat or cure their disease. In Taiwan, the most utilized CAM is traditional Chinese medicine. Therefore, many patients seek TCM for combined treatment of hyperthyroidism in Taiwan. Traditional Chinese medicine is an important component of healthcare in Taiwan and provides an alternative for hyperthyroidism treatment. Chinese herbal products represents the modern form of decoction in powder form, with more consistent with quality and convenience for patient use. The National Health Insurance Program fully reimburses patients for a single or formula Chinese herbal products in Taiwan. The Chinese herbal products used for the treatment of hyperthyroidism and their prescription patterns are yet to be fully elucidated. In this study, we used a subset of data from the National Health Insurance Research Database called the Longitudinal Health Insurance Database 2000, LEAD 2000, which may be representative of the characteristics of the general population of the whole nation. Of the 1 million randomly selected individuals in the LEAD 2000, we identified 17,707 patients with newly diagnosed with hyperthyroidism, ICD-9-CM242, between January 1st, 1997 and December 31st, 2013. Patients diagnosed with hyperthyroidism before the end of 1999 number was 3,448, and those who were younger than 20 years of age, the number was 865 were excluded. In total, 13,300 394 patients with hyperthyroidism were included in the analysis. Patients with hyperthyroidism were then divided into two groups. Those who visit TCM clinics for any indications at least once during the study or period, that is TCM user, and those who were never visit TCM clinics after the first hyperthyroidism diagnosis, that is TCM non-user. To determine the independent variables for the use of Chinese herbal products among patients with hyperthyroidism, we studied the demographic factors of sex, age, occupational status, and the residential area, and the risk factors for hyperthyroidism. The list of reimbursed Chinese herbal products was downloaded from the website of the Bureau of National Health Insurance. Corresponding drug information on the specific mixture or name was then obtained from the Committee on Chinese Medicine and the pharmacy website. Differences in baseline characteristics between the TCM user and the non-user groups were examined using chi-square tests and Fisher's exact tests for categorical variables and students' t-tests for continuous variables. Multiple logistic regression was conducted to evaluate demographic characteristics and comorbidity that correlated with TCM use. The model produced odds ratio and corresponding 95% confidence intervals. All statistical analyses were performed using SS software version 9.4. Two tail values below 0.05 were considered significant. Among the 1 million randomly sampled patients from the National Health Insurance Research Database in 2000 to 2013, there were 13,394 newly diagnosed patients. During the observational period, the overall incidence of hyperthyroidism was 83.6 per 100,000 per year in Taiwan. About 73% of the patients with hyperthyroidism used TCM treatment. Female patients consisted 77.3% of the total patient population. More than 80% of the patients with hyperthyroidism receiving TCM treatment were women. Nearly half of the patients were diagnosed with hyperthyroidism at an age between 30 and 49 years. Taipei, which is the capital of Taiwan, was the geographical area of the highest prevalence of hyperthyroidism. Diabetes mellitus was the most common comorbidity in patients with hyperthyroidism. The TCM treatment patients were significantly associated with a decreased risk of atrial fibrillation and congestive heart failure in comparison with the non-TCM treatment patients. The most common TCM prescription pattern for patients with hyperthyroidism contained 5 to 8 combinations of a formula Chinese herbal product or a single herb Chinese herbal product. There was an average of 6.67 Chinese herbal products per single prescription. The 3 most commonly prescribed formulas Chinese herbal products for hyperthyroidism were 加味逍遥散、炙甘草汤 and